Cash for cloture. That's what some are calling the wheeling and dealing that went down to get enough senators on board to pass the health care bill.
Among them, physician and Republican Congressman Tom Price, who says the senators weren't working through the weekend to improve the health bill, but to see what kind of payoffs they could get. And we welcome him now. Thank you for being here, Representative.
Thanks, Liz, so much. Appreciate it.
Okay, so give us your biggest criticism here. Yes, there were a lot of compromises, but there are always compromises, are there not, when it comes to these bills?
Well, there are on a policy standpoint when they affect the entire nation, but what we saw on this is what the American people are so disgusted about, and that is that an individual senator got a favorite deal for his state so that citizens in your state, citizens in the state of Georgia, now will be paying, and every other state across this land will be paying more for Medicaid than the citizens in the state of Nebraska. That's not only unfair, it's wrong, and it may be unconstitutional. So selling your vote in this blatant way is the kind of thing that the American people are sick and tired of, and that's why two-thirds of them say, stop this nonsense, stop this bill.
Now, Congressman, you're referring to Senator Ben Nelson out of Nebraska, but the other criticism, too, is that Republicans are basically saying that this is really not true market reform. You can't declare victory because it won't really bend the cost curve. What do you say to that?
No, you're absolutely right. In fact, it'll increase costs of health care in this nation. It'll decrease access because it will have to ration care in order for them to get the, quote, savings that they describe. So this victory lap that the Democrat senators are running and the applause that you just heard is not being echoed around this nation. In fact, what is being echoed is real concern about the fiscal state of our country and the fact that this health bill is only going to make it worse, not better. And at the same time, it will not improve quality of health care.
But Representative Price, I want to get back to the issue of compromises because it's a very sensitive issue. As you mentioned, it appears some states are getting more money and some favoritism here. But if you reach back to other bills, I mean, the most recent, we just talked about this in the last hour, would be the TARP, the original TARP under President Bush and Henry Paulson. They were promising things like, $128 million for car racing tracks, $10 million for small film and television producers, which was probably California, I'm not sure, but $6 million for makers of kids' wooden arrows. This happens with the Farm Bill of the past back in 2007. Is it really fair to say that it's a bad thing to compromise to get something passed?
Well, look, we're not talking about compromises. What you've just described are the classic earmarks that I have forsworn. I think that they're corrupting of the process and wrong. But those are different than what has happened in this instance. What's happened in this instance is that Senator Nelson and some other senators who got for their state a different obligation on the part of their citizens going forward to contribute to a federal program, the Medicaid program, and so that they contribute less than you contribute and I contribute as a citizen. That's wrong, and I believe it potentially is unconstitutional.
You know, Congressman, talk a little bit about the carve-out of the Cadillac tax on, for example, 17 states apparently are not going to be hit with that Cadillac tax, and they happen to be high-cost states, and also longshoremen and other key constituents are not going to be hit with the Cadillac tax on health plans. Talk a little bit about that.
Yeah, one of the mainstays of our society, the reason that we're held together is because everybody's treated equally. What happened in this bill is that some are more equal than others, and that's going forward, not just with a specific piece of amount of money for a program. In this instance, 17 states, the Cadillac plans, especially the ones held by the unions, will not have the tax imposed on them as they will in other states. Again, that's unequal treatment. I believe it is quite possibly a violation of the 14th Amendment, Equal Protection Clause. And consequently, we believe that, again, we ought to step back, stop the nonsense, start again. Let's work together in a positive bipartisan way, not in a way where 60 senators jump up and down and pat themselves on the back for something that two-thirds of the American people oppose.
If we did start again, Representative, what would you like to see in there? What would you like to see changed? A lot of Republicans did not like the public option. That's not in there. They didn't like when there were additions of people to the Medicare rolls. That was backed away from. But what would you like to see in it?
Well, there are a couple specific items around which I think we could all agree. One is that you've got to get folks insured. You can do that in a very positive way that provides them the opportunity to pick the health coverage that they want, give them the financial incentive to pick the coverage that they want, not that the government wants for them. Secondly, we ought to solve the challenges of portability and pre-existing illnesses and injuries. You ought not lose your insurance if you change your job or you lose your job. And you ought not be priced out of the market if you have an awful diagnosis or injury. Third, it's imperative that we say that physicians and patients and their families are the ones that make medical decisions. This bill will destroy that independent medical decision-making process. And finally, you can't be serious about health reform if you're not serious about lawsuit abuse reform. This bill does nothing to improve that. Yes, tort reform.
Representative Price, thank you so much for joining us. Is joining us now.